The time is just gone 8:34 a.m. We continue with the show this morning, and it's time now to link up with the chairperson of the South African Medical Association, Dr. Angelique Coetzee. We're talking about healthcare workers receiving the J&J booster shot. Dr. Coetzee, good morning to you. As always, we welcome you to the show.
Thank you so much. And as always, it's also a pleasure for me to be part of your show.
Dr. Coetzee, before we get to the J&J booster shot, the predictions that the fourth wave is expected to hit the country during the festive season. And at this point in time, where we are as far as the pandemic is concerned, the spread of the pandemic, it does appear to be under control. And the key question at this point in time is how real is this threat? Comes next month, comes December, comes the holiday season?
Very good question. We know that, and we have seen the past 2 weeks that our infectivity rate is less than 1.2%. It's around, this past week is less than 1%, which is great. And our death rates are also coming down. It's really, while each and every death is a loss, our death rate is much lower than it was the previous 2 weeks before this last week. So we are extremely happy to see that. We will know next week if it's still low at the same rate. We would then have jumped the gun regarding getting an increase in numbers because of the elections, which I don't think it's going to happen. I think we are in a pretty good space at this stage. However, going forward, middle of December, beginning of January might be a problem. That would be our next problem time. If we can jump that gun again, then we're out of that. But then you have to wait for Easter weekend and the winter months to come. But it will come. Eventually, it will come. And the reason why we say that is that natural immunity is also going down after at least between 10 to 15 months, as well as your vaccine-induced immunity. We know that also winds down, again, around about 6 to 8 months. And as we have said before, we think that going forward you would at least need a booster dose once a year.
Yes. Now, it's clear that South Africa, the vaccine drive is still ongoing. And looking at the number of people that have been already vaccinated in the country, clearly this has helped to an extent in terms of keeping the numbers down, Dr. Coetzee. But just looking at South Africa and comparing us to the rest of the world, because we see right across Europe, we see things just opening up. We see mega events, we see sporting events, and it does appear as if they're out of the woods. Now, what does South Africa need to do to get to that stage?
Well, if you look at Europe, they're definitely not out of the woods. They are running some of their highest numbers and infection rates. If you look at Germany and especially the UK, they are now seriously again trying to convince people to go and get their vaccines. And the reason why we want people vaccinated is two big reasons. The one is to keep them out of hospital with severe disease, to lessen the impact on the hospitals and to save lives. And the second reason is if you are vaccinated, you have a 1/3 chance of spreading the virus, while if you're not vaccinated, you have a 100% chance of spreading the virus to the person next to you. So if you can get more people vaccinated, the spreading of the virus would be less and less virulent going forward. And then again, we also noticed that in the UK and in Israel, they are now asking people above the age of 60 and 65 to go for their third booster doses, whether it was Moderna, whether it was Pfizer. And we know currently with the new data available that even with Johnson & Johnson, you would need to get a booster.
Yes, in fact, this is my question with regard to the booster, because I think one of the questions that's in a lot of people's mind is are these booster shots going to be an ongoing saga for years to come, where every year, without fail, one would need a booster shot?
Yeah, for now, that is what we predict needs to happen going forward. But the virus is unpredictable, and so that might play a role going forward in the type of vaccines. And we know that there's a lot of interest in developing new type of vaccines as well as methods. So while we now have the jab, going forward, we might get nasal spray. I know there are studies, but countries proceed with those studies, and it might even come in a pill tablet. So it depends. But for now, unfortunately, the short answer is yes. We will have to vaccinate on a regular basis.
Yes, now when the vaccines were available, we kicked off with healthcare workers, and we know that many healthcare workers initially had received the J&J vaccine, and with these booster shots, particularly with the J&J, it does appear as if kicking off with health workers will begin once again.
Yeah, and the reason for that is healthcare workers started in February to be vaccinated. Again, looking at the new data, remember that time there was no data available yet. Looking at the current data, 6 to 8 months later, and with evidence, scientific evidence, we know that they need to get a booster shot. Remember, we saw already breakthrough infections during the third wave of healthcare workers. Most of them were mild cases, but we noticed it. We then already started to raise concerns around it. But National Department of Health is in a very difficult position because they need the evidence. If they don't have proof and scientific evidence on this, it would be very, very difficult for them to defend their decisions in court. If someone takes them to court, let's say having a vaccine, as a booster Johnson & Johnson or a Pfizer one, and an adverse reaction happened, those people might take them to court. So if you don't have a structured, systemic, transparent, and ultimate defensible plan, that is now National Department of Health, then they might be in trouble. So they try to follow process. We are clinicians. We see it in a different light. And we are saying, listen, what we see, this is what we see, this is what the data is saying. But unfortunately, the National Department needs to follow process.
Yes, Dr. Coetzee, I've observed you mentioned data quite a few times. And for those who have not taken the vaccine, and now that the vaccine drive has been firmly entrenched and has been underway for quite a while, have we got sufficient data with regard to these vaccines, to side effects, and are we building some sort of intelligence as far as vaccinations are concerned, so that it could put people's minds to rest, particularly those who are still hesitant at this point in time in taking the vaccine?
Yeah, there is nearly on a, I want to say, daily basis, new scientific data becoming available with especially the studies. Most of them are done between the two mRNAs, that is now Pfizer and Moderna, and then with AstraZeneca and Johnson & Johnson. There's a lot of data coming and being available, good data. And the data is actually confirming what we have, again, said before, that the old story, it must be scientifically proven, and those data are there. So boosting of your Pfizer, Johnson & Johnson, was well tolerated. And the strongest responses were detected after you actually boosted with mRNA vaccines. But the current data on efficacy, on infection, transmission of boosters is good. They're more than the same than they were for when you took your first dose. There's not something after you taking your second dose on Johnson & Johnson or Pfizer that there's going to be worse adverse reactions. Your reaction where you have been injected might be a bit worse with Pfizer, but it's not something that is going to. That's a reaction of your body. It's not something that's going to kill you or make you feel uncomfortable.
Yes. Now, this booster drive, when is it likely to happen?
It's happening this weekend, and it's extremely important to have to look at these booster drives. The booster drives is a combination of private sector and public sector working together, trying to get people, especially on Saturdays, to get maximum people to come in for those who have difficulties during the week to get vaccinated or have other problems, to try to bring them to these facilities and sites and open up more sites over weekends to get people to be vaccinated. Remember, the more people we can get vaccinated, the less the virus or the spreading of the virus, as I have said, if you are vaccinated or you had a previous infection, the chances of spreading the virus is 1/3 of those non-vaccinated. And we need all hands on deck for a possible infection or a fourth wave coming in December. It's really important. And, looking at Europe and the crisis they are currently in, we know that a lot of South Africans are going to visit families and, they might bring it back. And if they're not vaccinated and somehow they manage to get into Europe and bring it back, it might be disastrous. Remember, this is how our first wave started. So the more people we can vaccinate in South Africa, the less we have to implement lockdown levels, high lockdown levels, and I think that's all what we all want. We don't want higher lockdown levels. We don't want our hospitals to be overburdened, and we want people to have mild diseases, and we don't want the 60-plussers to have severe COVID-19 ending up dying in the end of the day. So we don't want that. And unfortunately, the only two things that you can do is to vaccinate and to use your mask and that social distancing and to be out in the open as much as possible.
Just a final question, Dr. Coetzee. I see questions come up on my screen. I wanted to know whether they should be taking their card along with them for the booster shot.
Not that I'm aware of. The moment that you under the Sasonke, they sent to all healthcare workers an SMS. We had to register on that, and we had to sign an agreement again so that you want to participate. And once that is loaded, you will get an SMS with a number, and there's sites on where you can go and get your vaccination. And with this boomer vaccination weekend coming up, we are urging the healthcare workers. Look, at the end of the day, you as a healthcare worker, it's your choice. If you don't want to get a second booster dose, we are warning you. We are telling you that your immunity is going down, and that's your chance that you're taking. So if you want to wait until the National Department of Health has got enough evidence to also approve Pfizer as a second option, you're welcome to wait. But you have to weigh up the pros and cons of this.
Well, Dr. Coetzee, thank you very much for that, and we appreciate your time. As always here on Solar Media, all the best to you.
Thank you, and really, I hope all your listeners have got a great day. You as well. Thanks.
Thank you. Dr. Angelique Coetzee, Chairperson of the South African Medical Association.
Every 60 seconds,